Brain injury recovery can be quite challenging, not just for the person or the child who suffered the brain injury, but also for the families. Hi, I'm Dr. Julia. I'm a licensed pediatric psychologist, and I work a lot with families following brain injury. So one of the questions I get most often is, how long until my child returns to normal or back to baseline? And that's a very complicated question, and I'll leave it to your neurology and PM&R providers to answer that. But in short, we can expect primary recovery within the first 6 to 12 months. That's when you're going to see a pretty steep increase. And then after that, depending on the type of injury, up to 5 months is where we can see some progress still being made. So usually after an injury, your child will get acute care, whether that's in the ICU or just in a hospital floor, and then they will likely, depending on the severity of the injury, go to the inpatient rehab unit or the IRU of the hospital you're at, or be transferred to a dedicated rehab facility in a different institution. And after that, depending on where you live, you can either do a step-down program where it's like several times a week, or you can just do outpatient physical therapy, OT, speech, and psychology. And you'll have lots of different people part of your medical care team, and it can feel quite overwhelming, and so that's why psychology is often involved to kind of support and facilitate care for the child and for the family overall.